Well, May is Older Americans Month, and this year it comes as the cost of nursing homes and in-home care costs continue to rise, and that makes it even more crucial to start planning ahead. So Justin Halverson from Great Waters Financial is here to walk us through where to start. Thank you so much for being here.
Cece, it's great to be with you today.
Yeah, so a lot of families don't talk about long-term care until they're forced to. I mean, why do you think folks avoid the conversation?
I think there's a couple different reasons people avoid it. Number one, it's uncomfortable. It's not something we necessarily want to talk to over a dinner conversation with our family. I think a lot of people, excuse me, have this idea that it won't be me. Even though 70% of Americans over age 65 will incur some sort of long-term care expenses, it's never going to be us, right? It's going to be all those other people out there. And so I think those are probably the biggest two reasons we don't talk about it. And obviously the cost is high, and so people don't really want to think about that either.
That's true. I mean, change can be so scary, but we have to have those conversations.
We do.
You mentioned the costs. A lot of people assume that it's, maybe not expensive, but if we look at the numbers, how expensive can long-term care actually be?
It ranges based on the need that you'll have, but the average cost of full long-term care coverage or expenses in Minnesota is around $236,000 a year.
Wow. So
those costs are going up significantly, faster than the price of regular inflation. Even if we don't need long-term care, the average amount of money a couple will spend in retirement on healthcare expenses is about $330,000. So with it or without it, it's expensive to cover healthcare throughout retirement, so that's why we need to plan for it.
Absolutely. Hundreds of thousands of dollars is a big chunk of
I know.
change, so that needs a conversation. So a lot of people assume insurance or even Medicare will fully cover this, but that's not necessarily the full picture, right?
It really isn't.
Okay.
Unfortunately, I wish I could say it was.
Yeah.
But our regular health insurance, it doesn't cover long-term care expenses. Medicare will help with some. The first 20 days are fully covered, and then some of the coverage goes for another 80 days beyond that for a total of 100 days that Medicare will help. But after that, Medicare is not going to pay either. And so then people think, well, Medicaid will pay. Well, Medicaid only kicks in after we've gone through a thorough spend down process and basically spent all of our own assets on care. Then Medicaid will kick in, but that means all of our assets that we've saved for retirement have become vulnerable and could be gone after a period of time in the nursing home.
So you're picking up a big chunk of the tab even after a little bit of help. Okay, so we threw a lot at you, but for families watching who haven't started planning yet, what's one practical thing you can do right now to put yourself in a better spot?
I think in general they're doing it because they're watching this, so educate yourself, get the information, but then have a holistic plan that looks at everything for retirement. And one of those major things is going to be, how are we going to pay for long-term care? In a good holistic plan, it should show you your vulnerability. If you end up in the nursing home for 1, 3, 5 years, what's that cost going to be? How can your plan sustain it? And then maybe you need to look into things like long-term care insurance, where yes, you pay a little bit more up front, but then you can have some protection, coverage, and peace of mind moving forward. There's traditional policies where you pay, and if you don't go, you don't get the money back. But now there's some new hybrid policies where you pay, you fund the policy, and if you don't go to the nursing home, your family typically gets at least some of the money back, if not all of it, as a death benefit. So a lot of good options out there, but starts with education, moves into planning.
Yeah, conversation, education, and planning, and setting yourself up into different systems so you can take care of your loved ones.
100%, Cece.
Thank you so much for giving us these helpful tips. We'll have more on these tips and this important topic at KARE11.com/noon.